Welcome to New Hampshire's Business. I'm Fred Coker. New Hampshire's North Country doesn't have many hospitals or clinics, and those it does have, it takes people probably an hour or more to get there in some cases, and there's often no cell service. And many in the North Country are financially challenged, they're on the edge, and they're aging. So routine healthcare is not a guarantee, which is a main reason why New Hampshire's North Country created a health network. It's called the North Country Health Consortium, complete with a volunteer medical reserve corps, which I find interesting. Here are the members: Androscoggin Valley Hospital, Berlin; Upper Connecticut Valley Hospital, Colebrook; Weeks Medical Center, Lancaster; North Country Home Health and Hospice Agency in Littleton. And then there are these key partners: Coos County Family Health Services in Berlin, Indian Stream Health Center in Colebrook. Now, here's a quote from my guest whom I'm about to introduce. I don't know when the bubble is going to burst, but it's coming, and we're 1 or 2 years away of people with advanced chronic health conditions. That's Tom Mee, the CEO of North Country Healthcare, and he is with me. Welcome, Tom.
Great to be here, Fred. Thank you.
What's behind that quote?
Well, a year or so ago, we talked about, hospitals began to shut down so that we could divert more resources towards the care of critically ill COVID patients and have resources available for when the wave of the pandemic hit. That was the first wave. And I talked about this second wave, and I was specifically referring to patients who were setting aside preventative health care over the course of the last year because of the perception that hospitals were closed, they were afraid to go to the hospitals, or we simply weren't doing those procedures while in the pandemic phase. And I predicted then that patients would be presenting today with more chronic, more advanced healthcare conditions because through no fault of their own, they had to ignore preventative health over the course of the last year. And we're seeing that now. We're beginning to see our ERs return to normal and then some. We're diagnosing cancers at an advanced stage than had we been able to detect them a year ago. So I think the overwhelming message a year ago and again today is please, lives are saved with screening mammograms. Lives are saved with screening colonoscopies. Lives are saved when you go to see your physician. Hospitals are safe places to receive care, or affiliated FQHCs are safe. Please return. Please get your preventative health taken care of.
You've got an interesting model of healthcare, including what I saw was a medical reserve corps of volunteers. That's really interesting. They go out, and I assume they're trained, and they go out into the North Country to deliver healthcare, do they?
Well, they're not necessarily. It's more of a disaster planning network, and it's something that was put together in the event that we saw big waves of patients in the North Country. Due to our population density, we didn't see that. We didn't see our hospitals overrun with patients. What we are seeing, though, is an inability to move patients out of the North Country and south for tertiary care services because those hospitals are now overwhelmed with unvaccinated COVID patients in their ICUs.
What does the North Country need for healthcare delivery that it doesn't have? And I say that because I know that some in northern New Hampshire come south to get radiation treatment for cancer. I'm not aware that there's any radiation treatment in the North Country. Is that right?
That's correct. So those patients who do need radiation treatment would go south. And that's certainly something that we would look to bring to the North Country. But one of the core deficits today, and it's probably one that you didn't think of, is the presence of large-scale broadband in the North Country. When hospitals shut down and we had to curtail face-to-face visits, telehealth was the mechanism that kept us in contact with our patients. Well, telehealth isn't a useful tool in the absence of a strong broadband connection. So more than anything, that's what I'd be advocating for today.
Yeah, and I've been in Sandwich when I tried to get some cell phone service and couldn't get it, although I think they now have the promise of broadband from one of the electric companies up there. Anyhow, what's your main concern other than on what you just told me in the North Country in terms of getting everybody to work together? And I know you've got a consortium, but is that working?
It works. It works really well because it aligns all of the stakeholders that ordinarily might have had conflicting interests. It brings them all to the table. We can talk about these issues. And in the end, we all have the same goal. And that same goal is the vision of healthy communities. So to the extent that we can get it together at the table, we can avoid redundant activities. It's really been a big boost for the residents of the North Country.
Thanks, Tom. My thanks to Tom Mee, CEO of the North Country Healthcare.